Vikrant, can you hear me? It's already 4 o'clock, so we can start. Can your office check that ED and IDM has joined or not?
Yeah, Major General has joined.
Okay, okay, good.
Yeah, good evening, everyone. I'll now take a moment here to test test the mics of all the speakers and the moderator. Please unmute yourself and say hello.
Hello. Tom here.
Thank you, Tom.
Hello, can you hear me? ED and IDM.
Yes, sir, we can hear you.
Thank you.
Professor Santosh.
Yeah, hi Vikrant, hi everyone. Santosh here.
Thank you, sir.
Thanks, sir. Prema, ma'am.
I don't see Prema.
She'll be joining soon.
Okay.
Yeah, we'll begin shortly. Thank you, everyone.
There is power cut in UP, so I don't know how long we will be there.
Yeah. So, Michelle, you can begin with the introductions.
Yeah, you start with.
Thank you. A very good evening to everyone, and thank you so much for joining us on time for our COVID-19 panel discussion, Academy panel discussion. We welcome you all to another session of the COVID-19 Academy. The COVID-19 Academy is a joint collaboration between Sphere India, UNICEF, WHO India, and HCL Foundation, which aims to build capacities of frontline workers, volunteers, and outreach workers for COVID-19 response and preparedness. Today, we are holding a session on the occasion of World Humanitarian Day, a celebration of COVID-19 warriors. As we all know, humanitarians make up a large number of people who endanger their own lives to save others. They are often known to be the first to respond to a crisis and last to leave. Hence, such people deserve mention and celebration. World Humanitarian Day, celebrated on 19th August 2020, is to laud such heroes whose involvement in humanitarian services is beyond appreciation. This year, we will be celebrating COVID warriors, such as healthcare professionals, like nurses, doctors, paramedical staff, to policemen, among others who are at the forefront, selflessly risking their own lives to save others. For this session today, we have a very esteemed panel with us. We have Major General M.K. Bindal, Executive Director, NIDM, Tom White, Chief, Emergency Disaster Risk Reduction, UNICEF India, Professor Santosh Kumar, NIDM, Dr. Neeta Jain Padalkar, Head of Health Department, AMC, Rahul De, Manager CBTC, Red Arc India, and Dr. Tran Min Nguyen, WHO India, and Mr. Vikrant Mahajan, CEO, Sphere India. Let me take a moment to give you a brief introduction about all of our panelists. I will start with Major General M.K. Bindal, who is presently the Executive Director, National Institute of Disaster Management. He was commissioned into the Corps of Army Air Defense in December 1985. An alumnus of the National Defense Academy, Major General M.K. Bindal is a graduate of the Defense Services Staff College and has attended the prestigious Higher Command course at the Army War College, besides excelling in all other career courses in the Army. He holds a master's degree in Defense and Strategic Studies, as well as Masters of Philosophy in Defense and Management Studies. During his more than 3 decades of service, he has held important command and staff assignments. Welcome, sir. Next, we have Tom White, Chief, Emergency Disaster Risk Reduction at UNICEF India. A graduate from the London School of Hygiene and Tropical Medicine, Tom has worked extensively in diverse humanitarian situations across the world and has held important policy and humanitarian advisory positions, including with Department of International Development, UK. He's presently serving as the Chief, Emergency Disaster Risk Reduction at UNICEF India. Next, I would like to welcome Professor Santosh Kumar, Professor at NIDM, a disaster risk reduction, policy planning, and capacity development expert with 25 years of experience in different positions in the development planning and DRR sector. A PhD in economics, he has studied gender and development in IDS, Sussex, UK, and received professional training in disaster risk management from Israel. Backed with international work exposure at the World Bank and intergovernmental body of SARC, he has also worked at state levels in different capacities in UP Academy of Administration, Nainital, and IPA Jaipur. He is an experienced hand in designing, planning, and implementing mitigation and long-term disaster recovery plan and projects. Welcome, sir. We also have Dr. Neeta Jain Padalkar, Head of Health Department, AMC. Dr. Neeta has more than 10 years of experience of running a private hospital and joined Aurangabad Municipal Corporation as a medical officer in 1990. She has to her credits initiating for selection of AMC for European Commission's pilot project amongst all corporations in Maharashtra and successful implementation. Elected as a state committee member to study health system in the state of Punjab. During the ongoing pandemic, she has supported with massive COVID-19 testing in Aurangabad, which is highest per million in India. Next, we have Rahul De, Manager CBTC, Radar India. As the manager of training services for Radar India, Rahul is responsible for a dedicated training team and a pool of associate trainers delivering a variety of core and tailored training courses throughout the world to the humanitarian sector. Rahul has been working in the humanitarian sector more than 15 years and has expertise in various aspects of emergency project management and has sectoral expertise on wash, shelter, and food security. Next, we have Ms. Prema Gopalan, founder and executive director, Swayam Shikshan Prayog, which is a learning and development organization that has empowered over 180,000 rural women as entrepreneurs, farmers, and community leaders. At the core of Prema's belief is that excluded and resource-poor communities can be revitalized through economic growth and social progress if the true potential of grassroots women entrepreneurs is realized and tapped. Next, we have with us Dr. Tran Min No Nguyen from WHO India. He has completed MD in General Medicine and PhD in Vaccinology from University of Turku, Finland. He has 20 years of postgraduate experience in the field of public health. Dr. Tran Min initially joined WHO in Western Pacific Regional Office in Manila in the year 2000 as medical officer in child and adolescent health. In 2007, he was appointed as technical advisor to the Vietnam Field Epidemiology Training Program based in WHO country office in Hanoi. In 2014, he was reassigned as lead epidemiologist based in WHO Eastern Mediterranean Regional Office in Cairo, where he provided technical support in the areas of prevention and control of arboviral and zoonotic diseases. In the event of major emergencies, he has been deployed to support WHO field operations, occasionally to other regions, including Ebola outbreaks in West Africa 2015 and in Democratic Republic of Congo in 2019, and Rohingya refugee crisis in Bangladesh 2018. Prior to joining WHO, he served as senior epidemiologist in the National Public Health Institute, Finland. Since 2019, he has assumed the position of team lead for health security and emergencies based in WHO country office for India in Delhi. Last, I would like to invite Mr. Vikrant Mahajan, CEO, Sphere India. Vikrant has over 24 years of professional experience working at interagency policy level and frontline humanitarian action with government, UN, corporations, CSOs, and armed forces in diverse contexts. He has led interagency coordination for more than 100 disasters and represents on governance and policy level committees of several international organizations. He currently works as CEO of Sphere India. With that, we finish the introductions of our to Vikrant to please facilitate this session. Thank you.
Thank you so much, Michelle, for this introduction and the hosting this session. I think today is a great day to mark the celebration of the spirit of our frontline workers, the volunteers. Today on this day, as amid a global pandemic and some unprecedented needs, growing insecurity, aid workers, healthcare responders, they are staying and delivering to the world's most vulnerable people. If we look at the last year on record for the humanitarian, it has been a year of crisis a lot. I think there have been more than 483 people as humanitarians who got attacked, 125 got killed, 234 wounded. and 124 kidnapped. And the UN, among all of us, we strongly condemn such attacks on humanitarian. And what we see in this is a dedication, a perseverance, and a self-sacrifice of all the real-life heroes who represent the best of humanity as they're responding to the global pandemic of COVID-19 crisis, and resulting in a massive increase in the humanitarian needs worldwide. More, I think, what we're seeing also is closer home in India. And today, as we see a scenario building up in the NCR, the Gurgaon and we're getting up videos and photographs of the streets getting flooded. And there again, we are seeing is the front end volunteers, the volunteers from the communities in the action again. And to this spirit, which drives the humanitarian action, which derives all these results. And to these local heroes, today's session is dedicated. And I'll take opportunity to take few more names among our own. They will be joining the participants here also, and they are in fact the leaders who are leading it on the local fronts. Among us would be Dr. Subir Kumar from the IAG Jharkhand, Mr. Vishal Raymond from IAG Rajasthan, Father Jeevan Kennedy. He's a focal point for Sphere India in Tripura. There's Mr. Kirit, another, our frontline leader from IAG Gujarat. There's Mr. Shivraj Sharma, the representative from the IAG Madhya Pradesh. We have Father Biju joining from IAG Manipur. Then Mr. Nihar Ranjan Das, the manager for World Vision, representing the networks in Punjab and Haryana. My dear friend Chenthung Hamutse from the IAG Nagaland. There will be Mr. Alok Kumar Ghosh from the IAG West Bengal. Dr. Ajit Abdullah, the IAG Kozhikode Kerala. Mr. Manoranjan Das from IAG Odisha. Father Verghese, Assam. Dr. Bhanu, IAG UP, and also the Vice Chairperson of Sphere India. So there's Ms. Punita from IAG Chhattisgarh, Ms. Kusum, the convener of IAG Uttarakhand, and of course, I think we have among us the speakers is Ms. Prema Gopalan, another grassroots women leader, from the grassroots actions who have provided some excellent leadership at the global level also, and through her we will get a chance to hear some of the women leaders who actually working very closely on the grassroots here. So this and among other group of speakers today, I think we look forward to an interesting session and sharing here. And see, from here we take away, apart from celebrating and appreciating the actions of these local leaders, we look forward at what actions we take it forward, what thing we take it forward, so that we have a more improved localization and the local actors and the communities at the right center of our work, which we aspire to deliver and to be held ourselves accountable. With this, I think I would request now Major General Manoj Kumar Bindal for his opening inaugural address, and then we'll take it by the speakers one by one. Over to you, General Bindal.
Thank you, Vikrant. First of all, heartiest congratulations on the World Humanitarian Day. And there's no other better day and forum to celebrate this particular occasion. So I'm thankful to you and Professor Santosh Kumar for this collaboration with the COVID Sphere Academy and NIDM on disaster-related aspects. We are all aware that today is a day which we mark as a humanitarian day because it is in the remembrance of the then Secretary General of the Secretary General to Iraq, Sergio Vieira de Mello, because they were killed and 21 other colleagues were killed in the bombings in Baghdad. So this year is the 11th year of the special celebration. We're paying homage to the heroes who have contributed and given up their lives in providing humanitarian aid to other communities of the world, sometimes even under most extreme circumstances. Because we have seen now the way the frontline workers are facing so many odds, and still they are continuing to do their work. So, for instance, this year theme for the this year is "We are humanitarian workers," while the 2011 theme was "People helping people." So the theme is also changing, and it is becoming more and more inclusive. That we have to be consider ourselves as humanitarian workers and give back to the society what they're giving us. Uh, Real hero, life heroes celebrations going on today. In fact, today only in Delhi government also a number of these frontline workers have been called to the Delhi government office and they are being facilitated. So there is a marked increase in awareness among everyone that the humanitarian workers need to be supported. Their motivation level needs to be made increased, and they have to be insensitized through various means, even if it is just a clap like what we did for them in the month of March. So we have to show our appreciation to the people who are putting their lives at stake for saving others. Is the most noble job that one can do. And in this, the maximum work is being done by people on the ground, in which I will say the local community and the civil society organizations, the NGOs, the self-help groups, the various committees, they are actually doing human service, which most of often than not goes unnoticed, and uh, they are not uh, becoming they are not getting highlighted. So I think today we should take a pledge that we should always try to bring some of those people on our webinars who are doing this work on ground, and they start giving us these examples as to how what they are doing, so that the connect between policy interventions and actual happenings on ground is also connected. I thank Tom White, who has joined, and with us it is the first time we'll be having this webinar, that we will be uh, doing it much more, and we'll be doing on such important topics. So here I will finish, because there's a whole list of speakers who are going to speak after me, who have been working in this field, and I'm keen to listen to them. So I'll finish here, because this is a subject we can keep talking about, because I feel very, very personally about the humanitarian workers, because I myself was involved in so many disaster response and rescue operations in my life, that I know what it feels like, and what it feels for the poor man, if it is appreciated or he's not appreciated. A simple pat in the back when he has, along with you, he has lifted bricks to save someone's life. There's no harm in just turning around to him and patting his back and telling everyone, because of this chap, we could save this particular life. For him, that's a big thing. And for others also, it's a big motivation, because such an army officer, or now NDRF goes, is patting him and giving him the credit which they should have taken on their own. So it's just small actions are required, and this today commemorating a humanitarian day is a step in that direction, and especially Sphere Academy having a webinar on this issue today is a very, very special occasion. So I congratulate the Sphere Academy and Professor Santosh Kumar for thinking of this topic and bringing it out in the open. Because otherwise this day would have gone unnoticed. Uh, but now it will be there, because there's a live YouTube going on. We'll be putting in all our reports, and we'll keep getting highlighted in various media and other places. So with this, I'll finish, and thank you so much. And Tom White, once again, congratulations for your first webinar with NIDM. And over to you, Vikrant.
Thank you so much, General Bindal, for your sharing your thoughts and perspective. I think yes, it's indeed an important day, and also remembering, to the sacrifices the humanitarians have made in the line of duty. Our next speakers, I think we were hoping to have Prema Gopalan with us. Michelle, is she available now, or? Yeah, I think maybe Pramima is yet to join, so there are connectivity issues today. So I'll move to our next speaker is Mr. Tom White. As we've seen, Tom comes from a wide humanitarian experience worldwide and has held important positions both at the frontline action as well as on the policy level. So Tom, from your experiences and also from the perspective of a UN organization you represent, so what's your key message today? Over to you, Tom.
Thank you very much, Vikrant, and also Major General. Thank you very much for the credit there. I'm not sure I've earned the credit just yet. It's early days for me as a player in the Indian context, but I'm very pleased to be part of this particular celebration today. And I think we really need to recognize exactly that. It is a celebration of a lot of hard work, not just today, but obviously there's been a huge amount of effort by organizations, by individuals to bring us to where we are today. I would like to, if I may, I would like to share my screen and run us through a few slides without being a killjoy and taking us down the road of PowerPoint, but I thought this would be an interesting and pertinent way of sharing some initial thoughts from a UNICEF point of view, but also throwing in some personal perspectives here too. Just making sure you are actually able to see my screen. Oh, excuse me, bear with me. Right, so what I would like to do is, first of all, to pay huge respect to all the humanitarians out there, and I'll go into a lot more detail on that during the course of the next few minutes. But I've deliberately chosen this design of the opening page of my presentation here, simply because there are a lot of overlapping circles. And I think that's exactly what this meeting, this forum represents as well. We're all coming from different fora, from different corners, from different perspectives. Yet when it comes into the humanitarian workspace, we all have a role to play, and we need to find how best we can overlap to collaborate to ensure no gaps and minimize the overlap. But it really is important to recognize the various players across the field. So if we look at the situation of COVID-19 at the moment, it's a brand new virus. It's really taken the world by storm, very unfortunately, but this is the situation we face ourselves in today. The primary impact of COVID-19 is obviously health. There's no surprises there, but as the situation unfolds, we continue to learn about this, and we continue to learn somehow equally, we continue to learn as much as what we know, but also we continue to learn what we don't know about this virus and the way it impacts not only health, but also beyond health. How does it impact education? How does it impact livelihoods, etc.? And initially, the full spotlight of COVID-19 was on health. So kudos to all of those frontline health workers, whether they are clinicians, whether they are cleaners, mopping up, trying to sustain and maintain a safe working environment, accessible for the most vulnerable to reach, etc. But also the ambulance drivers, the community members who step in when there is no ambulance. You know, there are a remarkable number of people on the front line who go unrecognized day in, day out. I want to focus as well beyond the health. I want to focus on the ripple effect of the pandemic. And this is something that really, until now, is not fully understood. And we continue to discover new vulnerabilities as it reaches new corners of different communities that were previously unaffected by such things. So perhaps in the early days of the lockdown in India, immediately it was quite apparent that many of the communities working and living in the slum communities were immediately impacted, as they no longer had access to their livelihoods in the neighboring areas. The knock-on effects of that significantly is their ability to access essential basic social services. We talk about healthcare, that's one, whether it's through their own perception and fear of infection by COVID-19, or whether that's simply an inaccessibility of those services because the number of health workers has taken its toll, and therefore there is an insufficient workforce to be able to deliver those services. That's specific for health, but the same applies to other services across the board. Access to education, this is a major issue. Not just for today, where children across the country continue to struggle to access their basic education, but particularly for children who are from more impoverished backgrounds, who don't have access to the internet, children in rural areas where net coverage is not blanket. This is a problem for today, but it will continue to be a problem for the coming generation, perhaps multiple generations, as we see that this particular cohort of children is really struggling to get adequately educated, to have access to information that perhaps we all take for granted, perhaps no more. But this is something that will affect the workforce and human resource development for future generations to come if we don't find a quick fix to this. The mental health issues, again, something that's not fully understood at this stage, but really, people working, even everybody on this call, how many remote video calls do we take every day? What's the impact of this? And that's just for us. Imagine the impact on the more vulnerable across the board. And then the protection issues. How many, I talk from the children point of view being UNICEF, but it applies across the board. How many people, women, children particularly, are finding that they are more exposed to violence, yet no longer really able to tap into the social protection networks that perhaps they were once used to and took for granted. On top of all this COVID, we have the regular multiple hazard emergency contexts that we somehow consider our bread and butter day in, day out. We talk about the floods, particularly pertinent at the moment. We talk about cyclones and droughts and so on. So these multiple hazards that routinely occur in a very predictable fashion across the country are now particularly exacerbated by the changing climate. And this is, I wanted to mention this because we cannot neglect this point, that year in, year out, we see this escalating trend of the impact of a climate change in remote communities. We see these vulnerabilities shifting. And then on top of this, we have the COVID-19 context and somehow the need, the demand, the responsibility on humanitarians' shoulders to continue to deliver the life-saving support to the most vulnerable in a situation where now it's important to consider as well how to do this safely, how to deliver those services without exposing the most vulnerable to something that could actually be even more life-threatening. Still, to be continued because we don't yet know the full context of this disease or its impacts across the rippling effect across the communities. So in summary, it's not business as usual. COVID-19 does not discriminate. We know this. Perhaps it affects some more than others, although the data is still limited, the evidence is still limited, and we continue to learn about who it affects and how. We talk about the frontline workers being exposed and at risk. Absolutely, they are on the front line of this response to COVID-19, as well as the response to the floods, to the cyclones, etc., as well. But they're equally on the front line and exposed and at risk to potential backlash from affected and at-risk communities. Everybody globally knew nothing about this disease and the virus just a few months ago. And suddenly when it turns up as a key issue that's affecting your neighbors, affecting somebody within your own household, naturally there is an adverse reaction. Naturally, there's a reaction of fear, of hesitation, of perhaps even violence and backlash, pushing back at any newcomers that may come to your community, seemingly there to deliver assistance, but may be perceived as someone who presents a threat of infection or introduction of something that's not welcome, not fully understood. We talk about the need to sustain access to essential services safely. And still, this is not fully understood, but we need to be supporting each other, supporting humanitarians on the front line to be able to respond in an agile fashion, able to adapt as and when we know more. And equally, we need to be able to somehow provide clear and accurate information, not only to our frontline workers and humanitarians so that they can operate safely and effectively, but equally to be able to deliver clear and accurate information for the affected individuals and communities so that they can better understand where their risks are and how they can behave in a more responsible manner to reduce the risk of infection to others should they become infected. So we all have a role to play, and that's why I really appreciate this forum, because it really brings together a broad spectrum of players. We have a role to play to save lives primarily. We have a role to play to alleviate suffering in multiple contexts, but now with the overarching umbrella of COVID-19, which somehow plays a devastating impact across all of the sectors, still trying to work out how and where these impacts are being felt most. So we talk about, and the Major General clearly articulated this probably better than I will, but the communities at risk and affected, they are more often than not the first responders. It's so important to recognize them as the key players. They are affected by this. They know their context probably better than anybody else. But at the end of the day, in the event of a new sudden onset disaster, they are on the front line. Amongst them, the most vulnerable, the children. However, the children, while they are the most vulnerable and should absolutely be the center of any response, should also be included in the articulation and the working out, the defining of an appropriate response to the disaster. And perhaps also engaging the children in how best to mitigate those risks of a disaster. If we can engage with the children effectively, the children and the youths effectively, that paves a long way in engaging the rest of the community as agents of change to promote a better future for everyone. The government at all levels, I'm not going to say too much here because we've got far better representatives on the line, but I will say that government at all levels, whether it national, keeping a broad overview and the primary guardians of the state, or whether it's local in the Grand Panchayat levels, whether they are fully engaged, fully supported by all of us, they have tremendous responsibility on the shoulders, but at the same time, they're not alone. We are here to support, engage, and collaborate. Community-based organizations and NGOs. Sometimes in certain contexts, in certain situations, the forgotten unsung heroes because they somehow slip underneath the umbrella. But they are sometimes very well placed to shine a spotlight where the government systems are not able to reach, or in certain situations where systems are particularly stressed or stretched. And then there's the UN agencies, the viewpoint that I'm speaking from at the moment. I represent UNICEF, but within this forum, I'm happy to speak on behalf of one UN, where essentially there are a multitude of different agencies with different mandates, trying to be as joined up as possible. It's not always perfect, but there is a huge amount of capacity to be able to step in and to support with guidance, with policy, with particular support, whether to government, whether to non-government, and then equally the private sector, particularly in a situation like COVID-19. Somehow this is an opportunity to pause and to think about what role could be played by perhaps non-traditional actors in the humanitarian space. And I think that's a bit of a challenge to each of us to really question what role can we play and how best can we do this in a more effective way going forward, whether specific for COVID-19 or whether sensitive to COVID-19. But there is so much more that still needs to be done. And I guess the road ahead is a little bit bumpy, but we're lucky to have a road. So I'll stop there and thank you very much. Maybe last words, really just to pay kudos and credit to the frontline workers out there, whether the health workers, whether the water and sanitation workforce out there, you know, right the way across the board, the less visible people following up on unaccompanied children, separated minors, and so on. And maybe a message and a plea perhaps would be, this is a two-way street, to play on this analogy here. This is a two-way street. And while I'm fortunate to have the opportunity to send out a couple of messages here, I would also invite, whether right now, but more importantly, going forward in whichever forum, whether we meet on the streets or on the front line in the cyclone response, this is a two-way street, and I really welcome any feedback and specific guidance on how better we can play our role. Thank you.
Thank you so much, Tom. I think that was a very interesting presentation, and also the very interesting way you put up some of the thoughts across that we should be considering under the World Humanitarian Day today. And straight away, I think we have a long list of speakers. I move to for a quick sharing from another colleague from WHO, Dr. Tran, and more so leading from the health perspective. You know, if you what's your key message for the frontline workers today and on the World Humanitarian Day? Over to you, Dr. Tran.
Good afternoon, Vikran, colleagues, panelists, distinguished panelists. I'm audible?
Yes, sir, you're clearly audible.
Thank you. All right, so my pleasure to be invited in this distinguished group of guests, as well as this special day. Actually, my first thinking of upfront is that it is only today that we think at our frontline health workers or so-called COVID warriors. I think it should be like any day. Actually, in my current work, we are WHO, as you know, the team we have around India, some around more than 2,600 personnel in all the states, all except one state, but across, and we feel the hardship, we feel the challenges on very much daily basis, and I wonder when talking with my colleagues, close colleagues and colleagues on the field, my first question to them that how are they doing? Because I think that on not only World Humanitarian Day, but every day now since the past 6 months about that we have been going through this very challenging time. And I think that the first thing that I really like to first congratulate and also laud all the audience in this webinar, because you more or less you are part of this so-called frontline workers as well as COVID warriors, and my appreciation to all of them you have contributed so far to this response. So indeed, WHO, this is a health crisis. WHO is one of the lead agencies, but why my colleague Tom from UNICEF say is much beyond health, and it affects all aspects of the society at individual levels, as families, communities. And I think that we need to constantly think that our response, our COVID warriors, they not only work, they have their families, they have their children who cannot get back to the school. So all these dimension of these unprecedented events make even harder to understand and comprehend how a daunting task that we all health workers, frontline health workers are facing. So these days, really, we already, Major General already highlight very well that the world is so different, vulnerable group, people in needs. All the time we have disasters, we have, without COVID, we have so many of the adverse event, crisis, health crisis, humanitarian crisis all around the world. And now on the top of that, we have COVID. So this is a very unusual, unprecedented time. As WHO, of course, we have been asked constantly that how does it look like, how we get out of this. I think that maybe it's not my short intervention. I would not go in much to details, but I believe that we all agree that it doesn't look like we will not. First of all, most likely we're going to live with COVID for a long time, for years to come. First thing, but the second thing also is that we may not. People have been asking that whether the vaccine would make a game changer in this whole response. Very, very conservative. Some, of course, expert opinion. We know that now the vaccine on the pipeline, but again, this is a new virus. Has been surprises since the very beginning. So a word of caution there that maybe yes, into 2021. we have a vaccine that is maybe for broader use of the world population. But again, what is a protective immunity, how long it lasts, etc. So these are open questions. So not let's not be too, let's say, too optimistic, neither pessimistic, but saying that we at the World Humanitarian Day, we need to bear in mind that this is a long haul, and we need to, that's why cherish and nurture the workforce that we have on the field. So this is really my second message on that. And may I also touch into how to get out of this. Overall, we understand even in Europe, in India, in Africa, in Latin America, we always say that the most efficient and the fastest way to get out of this is to protect the vulnerable. In Europe, it might be the elderly, but here the people who are, you have now noticed how the success story in Dharavi, how the so-called urban settlement, they have been able to contain the COVID. So the vulnerable group can be many different phases in different parts of the world. But this would be my message, that we try to join our forces to protect the vulnerable. And from the health perspective, another message, what would I say, that we tend to forget that right from the beginning of this crisis, COVID itself may not be the most damaging, but what we say that other, like the health needs, has been more and more now neglected. And I think that my colleague Tom well says in one of his slides that yes, this is also, we need to how to ensure the essential health services, other service, social protection as well. But when we come to health, as you know, that if now the health system, the basic primary health care doesn't work, we could see already that how damaging it is. That is not only COVID, but so-called the collateral damage of COVID. When the health system is on the brink of breakdown, we might anticipate a greater catastrophe. So this is that we need to join our forces to how to protect the and ensure the maintaining of continuing essential health services. And with this, I think that I would like to leave also the floor to other speakers. I'm happy to continue to the question answer session. Thank you, and over.
Thank you so much, Dr. Train. I think I'll move to the our next speaker. So maybe Rahul from a Radar, a young, again, a passionate humanitarian, which we see a lot of capacity building and frontline action. So Rahul, what's your message today?
Sure. Thanks, Vikrant. Hope I'm audible. Yeah.
Yeah, you're audible.
Okay. Thanks. Can I take the opportunity just to show a few slides, which represents the people I'm working with recently. Not too much I'm going to talk about the slides, but it's just to show the people we are with. Just to begin with, this is a very personal presentation for me, as well as from the organization perspective. So I talk very briefly about what as the organizations I'm being part of. And I also take the opportunity to share my own life experience as a frontline workers to this. First of all, I would like to start and thanking all the frontline workers who are in the field out there saving people's life with their self. So just to begin and to talk about, few of the people from Radar are at the forefront at various district level, at state level. They're working at the community or district administration, or supporting state level, even UN organizations, making people's lives safe and trying to support as much as they can to enhance people's capacity, either by training, either by making strategy, or either by their education and technical skill. Here, few of the names, apart from there, many names are there, but I respectfully take these people's name who are at present there at forefront supporting in the COVID response. With technical support, they are also doing supporting, making different standard procedure to deal with COVID. Also, as many of the speakers have mentioned, that India is not looking to or problematic by only one hazard. It's a multi-hazard, and the time we are right now is the time where flood is going to seen the cyclones. We have seen the changes in the climate. We are seeing the late arrival of monsoons. We are seeing the flooding are happening. So there are a few of them are also supporting at different level, different state levels to support the upcoming preparedness for disasters. We are also trying to support not only government, also the CSOs and different stakeholders, either developing how to work, either supporting them in coordination, either supporting them by trainings, making the SOPs, guidelines, recommendations on that at every state levels. We also supported with the support of different donor agency or our partners. We try to support the people who are the front workers, either health workers, either they're panchayat level. There are some of the block levels who are working for health. They're working to stress of the cases. So we try to, as much as we could do with the support of various of our partners. With that, this is one of the major thing I would like to focus on that. We did a need assessment for pan-India level. We did a need assessment specifically for Gujarat. After the findings of that, we try to do the frontline workers capacity building at front who are at the field level. If you see the photographs, you'll see the police personnel who are attending our trainings. In the left side of photograph, there are ASHA workers, there are panchayat workers, there are Anganwadi workers. We try to engage as much as people at the front level. We understand that this is a new pandemic where engaging directly is not possible. So we are also learning. We are also learning in various phases how to engage online. We are also tackling various questions, various challenges, but we have been trying to upgrade ourselves and do as much as better we can reach to the upfront level, the frontline workers. We're trying to work with the government organizations. Along with the COVID, as Thomas mentioned, that India has multi-hazard level. In the panchayat level, we need to get until the panchayat level. Also, we also engage with district administration for panchayat level planning. After the COVID, government has also said that panchayat level and village level preparedness is important. And it is also important that localized effort always make the difference. We also try to engage with the village level and panchayat level, how they can make their own plan and how they can tackle their own situation. So we also try to engage on that. These are the few of the slides which we have been working. We also, with our partners in Indonesia, we also tried and supporting Indonesia at the same frontline workers capacity building. So we are also trying to enhance, extend our support there too. We are also doing support with NIDM. We also engage with COVID Academy, various sessions which reach a wider range of people who are working at the field level. This is one of the slide which I'd like to say. The left side photograph is the photograph where my home used to be. I lost my home when, say, maybe when I was class 9. So this is my home, it was not the left side. My home used to be in the, where the river currently is. So coming from that place where I used to be a relief seeker, living in the camps in my childhood, going to school, crossing rivers, from there, and now spending humanitarian sector for 15 years in a few countries. What I understand is the frontline workers are the backbone of this sector. We can't deny that. Maybe we do policy level work, maybe we do capacity building, whatever we do. We can't deny that frontline workers are the backbone to the sector. Localized efforts and cultural preparedness is the key to resilience building. Till the time we talk about resilience building and we can't bring it to the localized level, we can't think about that the preparedness is going to happen. But that is the key to it. And I think more knowledge, skills, resources we can enable to the frontline workers, it's going to work. I'd like to take the opportunity where the whole world is talking about grand bargain, localization, all the policy level discussions are going on. I feel we need to think about, to take a pause and think about that, how we can enhance the capacity of the frontline workers, how we can give more powers to them. It's not about power to them just to implement. It's also getting how we can involve them in decision-making processes, how we can involve the frontline workers, the community in the work what we are deciding over there. That's going to work. While saying that, recognize the frontline workers, also not just thinking about what we all need to do. There's a lot of capacity already exists with the frontline workers. We are accepting that the community has a lot of capacity. All around the world, community frontline workers is the hub of the knowledge. They knows what the best for them. With the technical expertise, I think when we recognize and accept the capacity of the frontline workers, that's when I think we will do a true respect towards the frontline workers. While I'm presenting this sessions over here, I'm happy to share, this is the recent photographs of today's where the frontline workers are mobilizing their resources with the recent flood situation going on in Maharashtra. And these are the frontline workers whom we have trained for preparedness as a task force members. So I salute all the frontline workers and I wish them, I feel very happy and proud that coming from the field and sharing my experience over here and with my colleagues from Radar. I thank each and everyone, all the frontline workers who are out there day and night working for everybody's. Thank you all. Thanks.
Thanks so much, Rahul, for your personal perspective as well as from the perspective of Radar. All the good work you people are doing. Great. Just to check with my colleagues, Michelle, has Prema joined, been able to join? Will somebody do a check?
Yes, sir. Yes, sir. They have been able to join.
She has joined?
Yeah.
Yeah, so we have another passionate front line, humanitarian, Ms. Prema Gopalan, a cause of a woman and a woman leadership. Over to you, Prema. Look forward to listen to you.
Hi, everyone. Good evening. It does feel good to see and hear colleagues from the humanitarian field. I think a lot has been said about our message today. I would say that we represent a sector which is dedicated and committed to response and building resilience going forward. So that is something we take for granted. But I would say that post-COVID, we are seeing multiple kind of crises, and it's the climate crisis which affects the most poor and vulnerable. Our organization, Swayam Shikshan Prayog, we are based in Pune, working in over 7 states in the most climate hit regions. So it is the impact of the climate crisis that has driven people and workers to the cities. Yeah, I would ask Vikrant, please unmute my colleagues also. Yeah.
Yeah, what's the name, Prema?
Naseem and Godavari are there. Yeah.
Sorry? Nasir.
So
Naseem. Yeah, Naseem.
we have seen the tremendous force of from rural India. My colleague earlier has talked about the fact that communities matter the most, frontline workers matter the most. But I want to draw attention that the kind of support which is required for frontline workers, for organizations, and for women's groups to continue. Because what we are seeing since March, and I'll tell you from our personal experience and work experience, that the women's groups whom we had invested in for the last decade or so, these communities led by the women across Maharashtra, Bihar, and other states showed us the way when all of us were really confused as to what should be the course of action. These women's groups took up the leadership, and more than what NGOs can do, in over 600 communities, we saw them getting into action, supporting the returning migrants, supporting the farmers to follow physical distancing and take labor for work so that livelihoods could restart, lobbying with the PDS systems to ensure, and an example is that in over 50 villages supported by UNICEF Maharashtra, more than 25,000 families got rations, free rations. Now, these entitlements and more have been announced by the government, but it is absolute struggle for those who have returned to their villages in terms of their lifestyle, in terms of getting to restart livelihoods, or even just basically surviving and staving off hunger every day. So as earlier Tom emphasized, it's not business as usual, and it's definitely not business as usual at all for the poor who have no safety net. So we are talking about a period now where the impact of the virus is spreading to rural India, and we have health systems, especially the primary health care and the rural hospitals, all entirely focused on treatment. So this day, I want to draw attention that we need to engage local governments, panchayats, and community-based organizations in shifting the focus to COVID prevention, in shifting the focus to assessment, containing the spread, and looking at how to build health in very hostile conditions. Currently, the private doctors, the primary health care services are just not accessible by the poor. So all of us are in this work trying to build safety nets. And the message I want to give today is basically support funding solutions by the poor, support women's groups and CBOs in coming up with local innovative solutions for livelihoods, for containing the spread, and to build a more inclusive recovery. Vikrant, I'd like to invite here my colleague Naseem and Godavari,
Yeah,
right
Naseem,
from the field, from our scaled up initiative with UNICEF in more than 3 districts where we are supporting the government systems, the districts and the local panchayats, over 3,000 of them.
नसीम जी आप अपनी बात कर सकते हैं, आई थिंक यू कैन, आप अनम्यूट करके यू कैन आप अपनी बात कहिए नसीम जी।
जी जी, थैंक यू, थैंक यू। गुड इवनिंग सबको। मैं और गोदावरी साथ में हैं और हम लोग बहुत खुशी है कि हमको वापस एक बार फिर से हमारे अनुभव को शेयर करने का मौका मिल रहा है। लॉकडाउन के बाद और जिस कोविड का स्प्रेड होने की वजह से प्रेमाताई ने बताया, हमारे यहाँ सबसे पहले महिलाओं ने अपने आप को ऑर्गेनाइज किया और खुद को एक नाम दिया कि हम, जैसे हमारी एक पहचान है एसएसपी की, कि जो भी महिला गांव में अपने लीडरशिप लेके काम करते हैं हम उसको सखी बोलते हैं। सखी मीन्स विमेन्स फ्रेंड, जो लोगों के लिए अपने साथ साथ दो लोगों के लिए भी काम करती है। तो ये महिलाओं ने सखी टास्क फोर्स का गठन किया और गांव में जो जैसे लॉकडाउन के बाद जो सबसे बड़ा समस्या आया था वो माइग्रेंट को लेके था, दूसरा फूड सिक्योरिटी को लेके था, रोजगार का प्रश्न था। तो ये सारे प्रश्नों को लेके हम ग्राम पंचायत के साथ काम करना शुरू किया और 23,000 से ज्यादा लोगों को राशन पहुंचाने के लिए काम किया और 10,000 से ज्यादा माइग्रेंट्स को रोजगार और उनकी सेफ्टी सिक्योरिटी के लिए, जैसे सोशल प्रोटेक्शन के लिए काम किया। तो मेरे साथ गोदावरी है जो सखी टास्क फोर्स की लीडर है, वो अपना अनुभव अपने सामने रखेंगी हिंदी में ही। शायद विक्रांत सर को इसका ट्रांसलेशन करना पड़ेगा अगर, या फिर मैं कर दूँ। थैंक यू। गोदावरी।
नमस्ते, मेरा नाम गोदावरी है, मैं फेडरेशन की लीडर हूँ। और सबसे पहले मैं आपको मेरा हिंदी अच्छा नहीं है, क्षमा मांगती हूँ कि कुछ गड़बड़ हिंदी में आती है। तो हमारे जो महिला है सखी टास्क फोर्स की जो भी महिला गांव में जो काम करती है, तो जो महिला ने बहुत अच्छे से काम किया है कि जैसा कि गांव में माइग्रेंट लोगों के साथ अच्छे से काम किया है, उनका सर्वे किया है। और जो क्वारंटाइन सेंटर थे तो क्वारंटाइन सेंटर में अच्छा सुविधा है क्या, पानी कैसा है, टॉयलेट है क्या, क्लीन कैसे रखते हैं, ये सब बारे में जाके वो सब खुद देखे। और कुछ लोग जो बाहर से माइग्रेंट लोग आए थे गांव में, तो उनको भी बहुत सारे लॉकडाउन के बारे में बाद उनको बहुत प्रॉब्लम था, तो उनको खाने का पीने का, और जो गांव के बहुत सारे गरीब गरजू लोग हैं तो उनको भी बहुत मदद किया है। और जैसा माइग्रेंट लोगों को काम भी मिला के दिया है। जैसे हमारे जो बहुत सारे गांव है, फिर एक गांव है कि जैसा बसवंतवाड़ी गांव है, तो बसवंतवाड़ी गांव में जो माइग्रेंट लोग आए थे तो उनको एमआरजीएस के, जैसा कि ग्राम पंचायत के साथ, लोकल ग्राम पंचायत है तो उनके साथ काम किया है। जैसा एमआरजीएस का काम है तो उनको मिला के दिया और उनके हाथ में ये काम करने के बाद पैसा भी आया है। और माइग्रेंट लोगों को थोड़ा बिजनेस भी जैसा सपोर्ट भी किया है कि जैसा बचत गट से उसको लोन दिया है। और क्या हुआ था कि जैसे गांव के लोग बाहर गए थे, गांव छोड़ के माइग्रेंट हुए थे, गांव छोड़ के शहर में गए थे, तो वापिस वो लोग गांव में आए तो उनको एक तो खेती भी नहीं था और दूसरा कि अब भी काम भी नहीं था, तो इसलिए हमारे महिलाओं ने उनको खेती भी मिला के दिया और रोजगार हमें से काम भी मिला के दिया है। उनके साथ जो उनका खाना पीना है तो खाना पीना की भी हमारे महिलाओं ने बहुत अच्छे से सुविधा किया है। और दूसरा कि जैसा कि अभी नसीमता ने बोला कि रेशन कार्ड नहीं था, बहुत सारे लोगों को रेशन कार्ड का प्रॉब्लम था और रेशन नहीं मिलता था, तो हमने गांव से तालुका तक, जैसा ब्लॉक लेवल तहसीलदार होते हैं तो उनके साथ हमने मीटिंग किया और ट्रेनिंग करके उनको क्या प्रॉब्लम है और स्कीम क्या है, उनके लिए कुछ गाइडलाइन होती है कि स्कीम मिलने के लिए क्या होना चाहिए, तो ये सब हमारे महिला ने उनके साथ पार्टनरशिप करके वो मिला के भी दिया है। और बहुत अच्छे से महिला काम कर रहे हैं। और जैसा कि पंचायत के साथ साथ क्वारंटाइन सेंटर है गांव में, तो उधर भी जाके कोरोना कमेटी है तो कमेटी में भी हमारे महिला अच्छे से जाके बात कर रहे हैं कि कैसा गांव में नहीं होना चाहिए कि ये लोग कम होना चाहिए कि बाहर से आते तो ज्यादा नहीं होने का है। और जो अलग अलग डेमो है, जैसा कि गांव के लोगों के बहुत आदत कम होती है कि हमेशा क्लीन रहना है जैसा सैनिटाइजर का यूज करना है, मास्क करना है, तो या हमें हमारे महिलाओं ने डेमो करके दिखाया कि हर वार्ड, गली, पंचायत जो भी जगह है जिधर वस्ती में जाके हाथ धोने का डेमो करना है, सामाजिक अंतर कैसा रखने का है, और मास्क लगाने का। बहुत लोग तो मास्क नहीं पहनते थे, तो अभी हमने जैसा कि हमको यूनिसेफ ने भी थोड़ा मदद किया था, और हमारे महिलाओं ने भी कि ये सब हमने उनको डिस्ट्रीब्यूट भी किया है कि जैसा मास्क है, सैनिटाइजर है, हैंड वॉश है, तो ये हमने हैंड ग्लोव्स है, तो ये हमने लोगों को दिया है और उनको आदत भी लगाया है कि ये अच्छे से अभी सब लोग कर रहे हैं। इसलिए थोड़ा हमारे यहाँ बहुत जैसा कि गांव में बहुत कम लोग ये मिल रहे हैं कि थोड़े कम इफेक्ट हुआ है। और हमने उसके साथ खेती के भी बारे में, जैसा कि किचन गार्डन भी गांव में बहुत, न्यूट्रिशन भी चाहिए, तो न्यूट्रिशन के लिए बहुत सारे लोगों ने ये किया है कि जैसा किचन गार्डन। हाँ,
ट्रांसलेशन थोड़ा।
अच्छा,
विक्रांत।
Yes, I will intervene in here. Thank you. पहले तो नसीम जी और गोदावरी जी, क्या आपको मालूम है आज का जो ये वेबिनार हो रहा है उसका उसका मुख्य उद्देश्य क्या है?
हाँ हाँ मालूम है।
तो मैं
आज ह्यूमैनिटेरियन डे है और फ्रंट लाइन पे काम कर रहे हैं, हम उनके ऑनर के लिए ये डे सेलिब्रेट कर रहे हैं।
बिल्कुल।
हेलो,
और मैं यहाँ पे उपस्थित सभी जो भी स्पीकर्स हैं और सभी पार्टिसिपेंट्स की तरफ से और स्फीयर इंडिया की के सभी सदस्य संस्थाओं की तरफ से आप सबका बहुत बहुत आभार व्यक्त करता हूँ। और आज का दिन जो है ये आपके जैसे जो कि फ्रंट लाइन पे हमारे हीरोज हैं उनको सेलिब्रेट करने के लिए है। और मैं तहे दिल से आपका बहुत बहुत आभार व्यक्त करता हूं। और मेरी कोशिश रहेगी कि हम आगे आने के समय, जैसे कि गोदावरी जी ने कहा, हम उनको कैसे सपोर्ट कर सकें, आपके जो फ्रंट लाइन पे हमारे हीरोज काम कर रहे हैं उनको हम कैसे मदद कर सकें, इसके लिए हम हमेशा प्रयत्नशील रहेंगे। For the help of our audiences who are not who don't comprehend Hindi, very quick, Naseem, one of our frontline heroes, Naseem and Godavari, they shared how in the time of COVID and difficulties, they set up a task force, a women task force at the front end called Sakhi. Sakhi is again the Hindi word which means the woman friend. So, and with this task force, they have reached out to all the needy in this, not only in looking at the quarantine centers, the isolation quarantine center, the family counselings, but also the issues of the migrant workers, the nutrition and the nutrition aspect and other humanitarian needs which they are merging. And I have on behalf of the Sphere India coalition, the members, including these our distinguished speakers and the participants over here, I have expressed our sincere gratitude to these frontline heroes. That's where we are here today for. And एक बार मैं फिर से आपका आभार व्यक्त करता हूँ. And with this I will there's a video, a small video to be played. Michelle, are you ready for sharing that?
Yeah, yes, just a moment.
अपना वीडियो
Your volume need to be switched on, Michelle. You can probably click the. Okay, thank you so much, sister. I think we missed the volume, but we could see again the good work by the SSP, the women leadership from the Prema and the team, the frontline women leaders across the states of Bihar, Kerala, Maharashtra, Madhya Pradesh. They involved with some real frontline action, which highly appreciable, and our sincere gratitude for that.
Vikrant, one.
Yes, Prema, please.
Yeah, just to emphasize the message from our women that it's not just about leadership, but they are coming up with the solutions, and these grassroots solutions are for farmer-led agriculture, therefore women-led enterprises going into the market and creating circular local food economies to be more self-reliant. So basically, they are regenerating these rural economies by actually building resilience and building forward. I really want to emphasize that they're not working just on relief, but they have moved on to a very inclusive recovery, which was fueled by starting with the food relief and rations. But now they're looking forward to regenerating their economies and their communities in partnership with panchayats. And we are getting an extremely good response from the health system and the government. And we have scaled up these efforts to 3,000 communities with the help of the district administration. And I just want to inform everyone that there is a very good government order with full training modules to the panchayats, which has been done by UNICEF. And I would encourage that if any more information is needed, we can scale up this effort in every rural community in the country. Thanks so much.
I think the message and also the good work which you're doing, Prema. I'll now take over. There's another inspiring leadership, grassroots leadership, frontline leadership is coming from another panelist today, is Dr. Nita Padlekar. So more I see, we directly hear from her. So over to you, Dr. Nita.
Hello, Namaskar. Am I audible?
Yeah, we can hear you. Please go ahead.
Yeah. Namaskar. Good evening, everyone. First of all, I am congratulating the Sphere India for arranging such nice webinar.
We are missing your voice, ma'am. Okay, there seems to be some connection issue. I'm not able to hear Dr. Nita clearly.
And really, it's stress, financial, even the poor and vulnerable. I am being an administrator in the health sector. I'm a doctor. We are managing a pandemic all measures in our city. Basically, it's a new disease, new pandemic. No one knows how it goes, how it will behave, and what will be the course, and no definite treatment protocol, and nothing is in hand. Just we go on trial, and every day is a new guidelines were coming up from the ICMRs, from the governments. Accordingly, we were working. It's everything new for us. When basically after this 3-4 months working in this COVID pandemic as administrator, we come to know the disease. This is a new for us, but main crux of this disease, how to trace. It's a trace. Who is infected, who is vulnerable, or who is suspected case. You have to trace those patients, test them, whether they are positive or not. Once they are positive, then isolate them. After looking after this disease, it's a very high contagious. It spreads easily with the close contact. So we need to isolate the patient immediately and then treat. In this case, if we see for the mortality, those who are vulnerable and who are mainly with the comorbidity, they need to look more carefully, and they need a treatment and critical care. But for the other patient, if we look at the data which we have, almost 60 or more than 60% people, they are asymptomatic or very mild symptoms. They can be taken care of very easily, and just isolation is the key. Identification and isolation is the key of stopping the transmission chain, breaking this chain for transmitting the infection from one patient to the another patient. So these were the various things which these came across the very different experiences regarding the people, government machinery, even the private NGOs and all other. Because even the government, mainly basically there was a fear in the community, fear about the disease and pandemic in the community, that everyone was, if someone patient comes positive, then there is havoc in that house. All their 4 family members and that patient, they undergo the depression of now what will happen. We have positive. There are the guidelines to contain that area, so they feel that there is a social boycott for this family. No one will talk to them. Everyone will come and say, oh, there is a positive patient, don't go there. The surrounding neighbors, even they stop talking to those families, those members. They don't even interact, or they don't support anyway to that family once the one patient comes. This is a very bad part of this disease. Even we see the so many conditions, even in the case of deaths also. Once someday if death occurs, the relatives, and they deny the all the they left the body there only, and everything is done by the government machinery. At times we also face that the people, they says that it's a government sarkar ki bimari hai, it's a government disease, everything has to be done by the government. So we also face these things. But now slowly in against this, there are the good parts also. There are the so many NGOs people, they come with us. Even the volunteers, they come with us, and they supported us. Some counselors, they join us in our quarantine centers and in our isolation centers. They come, even the food supplies. When initially there was a lockdown period, when these needy poor people, even migrant and refugee, they need to take care of those. We need to take care of those people. But the many NGOs, they came forward and they provided the food supplies and all other their requirements. Even the people used to come and give them lecture and yoga and all that. Even both side, we saw the both side picture while controlling this or doing the administration of this pandemic. But this pandemic had an effect on, as my previous panelist already, everyone has talked about that. It's very much health. We have a direct effect on our health of the all society, community, even the social effect is also there, economical, personal. And even we see there is a mental health is at the even the problem, because many patients, many people, they undergo the depression and they remain that like that for 2 to 3 months. They didn't sustain the trauma of being a positive COVID positive patient. So it's a mental health is also very important. It is also getting problematic in this situation. We have to look at this angle also regarding these things. And this whole new pandemic teaches the new lifestyle to all of us, how to behave, how to do the social distancing, the physical distancing, and they focus on the health, how the health is important everywhere. Then again, that the budgeting of the health and health infrastructure, all the question arises within this pandemic. About the developing the health infrastructure, how it is important to focus on the health infrastructure, which is many times sidewise or little bit neglected sector everywhere. So these important things this pandemic teach us regarding this social distancing, using masks and social unnecessary gatherings and all that. We have to adopt this new style, new lifestyle, and live with it. So this is a new lesson from the pandemic. And I want to tell you that this pandemic teaches how we should maintain our health, because what we see in these cases, the so many patients, if you are positive and you are healthy enough and your immunity is good, then you can easily fight with this disease. So for better healthiness, good diet, good exercise is important for your health. And even though but for everyone, it is not for the young, old, for everyone from the day one. By we must adopt regular exercise and good food, healthy food. This will save you from the many diseases. So this is the basic crust to maintain your health and to help each other in such a pandemic situation. I am very much thankful for all of you for calling me, listening me, and calling me for this webinar. I am a little bit in hurry, so I want to let over. Thank you very much.
Thank you so much, Dr. Neeta. And rather, I would say on this World Humanitarian Day, we are express our gratitude to you for all the the good work you have been doing on the front line. Really admirable. Our sincere thanks to you.
Yes, thank you.
Also for joining us today. Now I will request some of our other frontline heroes, to show up and share briefly. Is Dr. Subir here from the IAG Jharkhand? I'm unmuting you, Dr. Subir. Maybe you can like to share briefly. Please accept the unmute. Yes, over to you, Dr. Subir.
Good evening, Vikrant sir, and all the panelists also. Actually, today I'll not able to speak much because I am having some problem related to my health, which I have shared with Kennedy. I have it's today day before yesterday. It was a hard day for me because facial paralysis it had. So I'm suffering with that. But I would like to celebrate the day by involving myself, because my field volunteers in Jharkhand has done extraordinarily. So I wanted to share something about them and wish them World Human Day to all of them, Humanitarian Day to all of them. Jharkhand is not doing well these days because of the condition. Slowly, it's more than 25,000 patients are active patients, and by today, 338 patients were dead. But I would like to talk something about volunteers, how volunteers had uh, how volunteers had get involved themselves in the entire process by using their own resources in COVID-19 pandemic. So they were the people who really had to work hard to mobilize government resources, and we also had to mobilize resources from the donors as well. So all the national and international agencies has spent more than uh, uh, 20 crore rupees worth from, including all the foreign funding also. So it was really a hard time to meet the gap between supply and demand from the community. So I really salute to all the volunteers today, how effectively they were involved themselves by using and mobilizing resources.
Thank you so much, Dr. Subin. And I think you are showing, in spite of your the bad health, you
Yeah.
able to rising to the occasion, and your leadership for appreciation of your volunteers. That's the spirit of humanitarians we are here today for. Thank you so much. And I think I can move forward to our colleague from Nagaland, Mr. Shenithung Homse. Sir, how are things in Nagaland? What's your word today? Over to you. You have to unmute yourself. Shantu, please unmute yourself. Yeah.
Good evening, friends. Thank you so much for inviting us to this auspicious program. And I am representing the Nagaland IEG, along with me, my friend, representing the NGOs. We are the coordinators of the NGO sector. So just prior to the lockdown, we are thankful that Vikram has also come to Nagaland, and we have a coordination meeting with the government functionaries and the non-governmental functionaries. And then we were planning to have a proper coordination meeting across this virus district, but unfortunately, before that could happen, lockdown have cut off all our, networking because of the movement, restriction of movement, and so forth. So IEG Nagaland being a very new nascent stage, unfortunately, we're not able to generate a proper coordinating with the government sector, because the convener of IEG Nagaland is the secretary of the NSTMA, and then the OST is also representing the government, and both of them are heavily engaged in the government activities because of the COVID-19. So, but nevertheless, we could able to organize ourselves in wherever we are in our own respective districts. We have got ourselves involved in so many other humanitarian service, raising our own resources, and at the same time, whenever there is possibility, we could able to cooperate with the district administration. That's a very good effort we have initiated. And one of our coordinator, my friend, who is representing the powerful Nagaland Baptist Churches Council, Social Wing, Nagaland Development Outreach. So they are also doing a lot of things in their own, mobilizing their own resources. That is very appreciable in one way. So hopefully that in the days to come, we would like to strengthen the coordinating effort of the both government functionaries and the non-governmental and civil society organizations. So with this, thank you so much for giving us this opportunity to present Nagaland. And one thing we are having a little concern about the COVID-19 cases. Nagaland is a very small state, but we have already having 3,500 COVID positive cases in our own ratio. It's an alarming, and then we are a little concerned about that. Nevertheless, everybody is working hard. Thank you so much.
Thank you so much, dear friend. I think I understand your concerns, and you said about the new IAG. I think we are rising up to new challenge, and we'll strive to stand with you and do more with you in time to come for sure. Now I'll request another young leader from IAG Chhattisgarh, Miss Punita Kumar. Over to you, Miss Punita.
Thank you, Vikrant. I would really I'm grateful that I've been given an opportunity to encourage as well as show my gratitude for the frontline workers. So frontline workers have always played a very vital role in bringing social change in the society, be it health or security. And this is an opportunity not only to encourage, but also to show our gratitude to their contributions in COVID-19 situation, especially considering the situation in Chhattisgarh. Many professionals like us, even find it after years of experience, we find it very difficult to work without SOPs and line of protocols. And here are the frontline defenders who stood with their wide knowledge and experience and little support, that they got in the initial days to strengthen the ongoing war against the pandemic. Our Mitanins, especially, I would like to mention them. And they are also popularly known as ASHA workers in other states. Would it still continue this fight for a long time ahead with the responsibility of vaccination once it will come, in order to control the spread of the disease? And in the future, they are the future leaders, and they have raised support as the backbone of the health system. So it was not only because of the relationship with the communities and the vigilance along with them, which made it possible to track, test, and control the COVID-19 situation with the returning of the migrants at the grassroots levels. They have contributed by donating their body vegetables, kitchen garden vegetables, to feed numerous people in the relief camps and quarantine centers. And it was so heartwarming.
Yeah,
so they have.
So much, Punita. I think we are also running out of time, but I think my colleagues will follow up with you for your message further. And I think we are out of time, but we'll quickly hear a few of us, the state frontline leaders. Maybe I request Sanjay Pandey. Sanjay ji.
Ji.
हाँ सर.
Yeah. Over to you, Sanjay ji.
थैंक यू विक्रांत. आज का वर्ल्ड ह्यूमैनिटेरियन डे पर आप सबका ये कार्यक्रम बहुत ही अच्छा, और हमें अच्छा लगता है इसमें जुड़कर आप लोगों से बात करने का. इसमें बिहार, ज़्यादा समय तो आप नहीं है, लेकिन हम ये बताऊं कि बिहार में जब ये अभी बिहार में जो भी अब डिजास्टर्स हो रहे हैं, दैट इज coming under the umbrella of COVID. It is COVID plus floods, COVID plus anything else. So based on that, I would like to just say a few things that Bihar Intelligence Agency Group, which is a group of agencies working in the field of disaster management in Bihar, उन्होंने जब जो ये लॉकडाउन डिक्लेयर हुआ था बिहार में, तो मार्च एंड में, तो उस समय से काफ़ी हम लोगों ने काफ़ी लोग एजेंसीज के साथ मिलकर, फिलैंथ्रोपिक ग्रुप्स के साथ मिलकर, कुछ CSR ग्रुप्स के साथ मिलकर रिलीफ डिस्ट्रीब्यूशन का काम किया. और बाद में जब माइग्रेट बिहार के जो वर्कर्स बाहर थे, वो जो लौटे बिहार के लिए, तो उस समय उनका जो समस्याएं थी, कुछ हमारा सामाजिक परिवेश ऐसा है कि वो पैदल पूरे देश से पैदल चले आ रहे थे. 5 मिनट वो पैदल चले आ रहे थे, पूरे देश से पैदल चले आ रहे थे, कहीं भूखे कहीं नंगे. उन लोगों के सहयोग के लिए हम लोग ने सेंटर पॉइंट्स पर काफी जगह पर उन पैक का अरेंजमेंट किया, और लगभग पर डे 3 से 4 हजार पैकेट फूड पैकेट्स डिस्ट्रीब्यूट किया जा रहा था. और इस 4 हजार फूड पैकेट्स बनाने में काफी लोगों का सहयोग रहा. उसमें फिलैंथ्रोपिक ग्रुप्स ऐसे भी लोग आए जो हमें रोड पर देखें, तो उन्होंने अपने तरफ से 600 पैकेट, ऐसे लोग भी थे जो 600 पैकेट पर डे, 700 पैकेट पर डे, 1000 पैकेट पर डे कुक फूड बनाकर हम लोग डिस्ट्रीब्यूशन पॉइंट्स पर देते थे. इसमें बिहार स्टेट डिजास्टर मैनेजमेंट अथॉरिटी का भी बड़ा प्रोएक्टिव रोल रहा कि वो वैसे दौरान में अवेयरनेस जनरेशन का जो जरूरत है कोविड में, सेफ डिस्टेंसिंग, फ्रीक्वेंट हैंड वॉशिंग वगैरह का, उस पर भी उन्होंने काफी हम लोगों के साथ सहयोग मिलकर काम किया. और इसमें एक बात और आई कि इतने लोग इसमें जुड़ते चले गए इस मुहिम में, और ऐसे अनसंग हीरोज इसमें आते चले गए कि हम लोगों ने आइडेंटिफाई किया जितने लोग उस समय माइग्रेंट्स लौट रहे थे, जो ट्रैवल के दौरान एक्सीडेंट से या कोविड से मर गए रास्ते में, उनके फैमिलीज को सपोर्ट करने का प्रयास किया गया. अराउंड 15 फैमिलीज को 60 लोग मरे थे बिहार में उस दौरान, बिहार के लोग पूरे इंडिया में आते समय, उसमें से 15 लोगों को सपोर्ट किया गया। उसमें से काफी जो विडोज थी, अगर वो कैपेबल थी तो उनको लाइवलीहुड डेवलपमेंट का सपोर्ट दिया गया, जिसमें एक मैं बताना चाहूंगा, नीलू वैशाली की लड़की थी, वो विडो हो गई, 23-24 साल की हार्डली होगी, 2 बच्चे थे, तो उसको हम लोगों ने ये सीविंग मशीन और कुछ कपड़े दे दिया गया कि फेस मास्क बनाओ और उसको देखो। तो वो इतना एम्पावर्ड हो गई कि वो फेस मास्क बनाई, बेची उसको, और अब वो एक कोचिंग इंस्टीट्यूट
इंटरप्ट कर रहा हूँ बीच में। हम बिहार के मुद्दों पे एक स्पेशल सत्र ऑर्गेनाइज करेंगे आपकी लीडरशिप के साथ में। आज का जो खास दिन है, हम तहे दिल से आपके काम की प्रशंसा करते हैं और आपके को आभार व्यक्त करते हैं। हम चाहेंगे कि आप ऐसे ही अपनी लीडरशिप से और भी कार्यकर्ताओं को इंस्पायर करें। Sanjay shared about the issues in Bihar in very brief, and also how it created a movement of coming together of all kind of people, including government and the frontline workers. Sanjay has been a long time seasoned friend working with the emergencies and leading the collective in Bihar. So we really appreciate for his work today. And we will have a special session on Bihar, definitely on COVID Academy very soon, along with Bihar IIG integration with Sanjay. I think time is a constraint. We really like to hear from all of us, the representative from the various state IIGs. But I think we cannot miss some of them to say that I would like to give a chance to Firdaus Wani, who is from Kashmir. So Firdaus ji, a brief one or 2 minutes small, how are things in Kashmir and what do you want to share with us? Over to you.
Dr. Vikrant, thank you very much for giving me this chance. Basically, I would call you a career, COVID warrior, because Vikrant sir, जिस तरह से आपने पूरे अप्रैल के महीने से ही ये सारे COVID-19 एकेडमी चलाकर ये वेबिनार स्टार्ट किए, and you started, creating awareness among people कि क्या है, किस तरह से इसको हैंडल करना है, बच्चों को किस तरह से देखना है. तो I have been I have been a regular participant of these webinars. So all of these webinars have been conducted very nicely and in a very organized manner. And I made it a point every day that whenever I saw that this COVID Academy under your guidance is going to conduct a webinar on any issue, whether I had interest in those issues or not, I would just make it a point, because this COVID-19 gave us abundant leisure time, and you gave us opportunity to utilize that abundant time in a very constructive manner. By far the best one was which was conducted yesterday. It was interfaith humanitarian dialogue regarding discrimination that is being done. Our faith, leaders, our gurus were there from all the religions. Almost everybody was there, and they talked. It was very nice to be in the audience, and I think that you have done a human service to the entire nation.
Firdaus ji, I think it's more about the real heroes. I think is your humility also, and we can have this, the mutual admiration society going on.
Yes,
but I think it's more about the real humanitarian work which is there and celebrating them. Yes. Thanks for being.
I wanted to underscore. I wanted to underscore the commendable job that you and your team did during this entire around three months. For the last 3 months, you have untiringly doing all these webinars. Almost every day we had a session for around 1 or 2 hours duration, and you roped in best people who spoke, who gave information, who just, the superstitions, the misconceptions that were associated with this COVID issue, they were removed. Thank you very much. Thank you very much.
Thank you so
Thank
much,
you very much.
Firdaus ji.
Thank you.
I'll last request maybe Dr. Bhanu from the UPIG, who also happens to be the Vice Chair of Sphere India. Over to you, Dr. Bhanu.
Thank you, Vikrant. I was hearing, and this was very nice occasion, rather I can say, to talk about it. Nice in the sense that it was not nice to celebrate, but it was nice to know that who are the people who were behind this, and then they lost their lives or they have done a lot. In UP also, it was a difficult task because lots of people, millions and millions of people were coming back from different states and they were suffering a lot. And many organizations, they help them. Like, I'll not name the organizations, but I'll say that those people who are helping the coming people by from health point of view, I mean, they were regarded like anything. Somebody said that if a person is having some pain in the foot and then blisters in the foot, and you just keep your hand below that, and then the kind of relief and the change in the psyche of that person, what they feel, I mean, it was great. We lost many medical and non-medical persons. Medical persons, they lost because of enthusiasm, as well as it was impossible for them to manage things the way COVID was spreading. The transmission was in such a way, and it's a tricky pattern where medicines were not working, and where, I mean, when they were thinking it's a respiratory problem, it was a coagulation problem, blood clotting problem. But non-doctors, there are so many, and non-doctors, you can say nurses, you can say other pathologists, they were there. But those people who were sanitizing things, they suffered a lot. Those people who were doing non-skilled work, transporting patients, the ambulances were there. So these people, I think they have done commendable job, because I mean, very sorry, many places, many occasions, they could not be recognized the way they should have been. And you know, the triage kind of thing, the triage is segmenting patient who is serious and who is non-serious. It was very difficult here also. So because it was not like other disasters where you see that easily you can separate who is serious and who is more serious and who is less serious. Here, a person is normal and suddenly becomes serious. So transporting that person, then there were many people, we can say warriors, the family members. They are also warriors because they were taking care of somebody with kadha and steam inhalation and supporting people. They had courage to do all that. So kudos to the system. I mean, many things could not be done, that's true, but all those things which were done, and this was first, I think, of its kind, where the complex situation is being seen, and even today also the complexity is aggravating. So I think we need to learn more. And yesterday only I was talking to somebody that it's a time for us to learn more and more that how to deal with this kind of situation, how to understand the risk, because the challenges were less medical and more non-medical. So that was the issue which was not being understood or perceived by our system. I think that should have been taken and very rightly. Again, I'll say, like Jammu and Kashmir friend was telling, that Sphere has done wonderful job in this COVID process, and commendable. So all of you are, I mean, tirelessly you are working. Great things are being done. Thank you so much, Vikrant, for giving me time.
Thank you so much, sir. I think I'll share one graphic, my team has prepared. I think there are more speakers here which were to share. Maybe I'm not able to put it on the screen. Okay, so I'll share, or we share the WhatsApp group. It's the, I think maybe you can see, are you able to see it now?
Yeah, screen is seen, but not the group.
Okay, so we will be reaching out to all of you. Our firstly, I think the leaders from the IAG, many of whom you have not spoken it here today. We will take a record of your message and expectations, maybe as a next phase of the COVID Academy, and our other works are in progress now. So we will look at it, that how we can support you more in this, and we come up to the expectation of the our frontline leaders, all of you here. That will be what we'll strive to. And also, I take an opportunity now to thanks on behalf of once again Sphere India management, the chairperson, vice chair is himself, he is just speaking here.
Vikrant, if you're closing,
The entire executive committee of Sphere India, all the membership.
Vikrant, are you closing it?
Sorry, sir.
Are you closing?
Do you want to say something, Professor Santosh?
Of course, yes.
Sir, over to you, sir.
Thank you so much, because I thought I'll get an opportunity, but anyway, it was very heartening to listen to all those COVID warriors and also the frontline workers who have been spending their whole lifetime in managing the lives of others. This is the true definition which we say that what we learned in the disaster environment regarding the compassion and the love. So these two are, unless and until you have in the gene, you can't become this frontline worker. The second point, which I would quickly summarize here in terms of that 5 points from our side as a partner of that Sphere and today's program from National Institute of Disaster Management, I'll say 5 things as a way ahead. One is this redefining the whole this definition of redefining this the who are the frontline workers. But because in COVID-19, the doctor is at one part, they were doing the workers, the ward managers, they were doing, the ward boys were there, and also that those who are receiving the patient, they were there, and also the local police, the ambulance drivers, they were taking care of that. That probably we forget them when we start acknowledging who are the frontline workers. Even this entire lockdown and this, you said that entire administration also, they worked as a frontline worker because this is their job, they have to do it. So that is why they are doing it. But second is this, many of instances what we are seeing, government of Kerala started volunteerism for this COVID-19 and the flood management, and NDMA also started. So whether these volunteers are going to get protected by certain rules and regulations, or this frontline workers will work as a kind of a voluntary workers, as a kind of a informal sector, or this can also be formalized with some support to them. Because we need to strengthen them also, but for that strengthening, what we need to do for the future. So this is another point which I would like to mention. Third is that what Tom spoke from UNICEF, that WHO, all are facing crisis. We all said that we are into a deep crisis. So how we are strengthening institution, and everybody felt about this need for the capacity development. And other than COVID also, we have learned that any high risk, and if we need to reduce the impact, we have to build the capacity. Risk, hazard, risk and vulnerability is a typical example which we keep giving, and capacity is divided by capacity. So that if denominator is increased, then probably we would be able to face. So how this C, whose C's, and how we are going to take up from the national level to the local level to the front line. I was listening to this Godavari and Naseem also. It's a wonderful. I was also associated some point of time interacting with them. Then we are doing it. So what I'm trying to make is that somebody is saying that we are doing it in an ad hoc manner. All the frontline worker, they whatever they think is the best, they are doing it. But whether we need to have a SOP also, so more to a streamline. So another point is that how to work for the streamlining, develop SOPs for them. And for every disaster, we are thinking cascading disaster is much more important. Just to talk about COVID-19 itself, COVID-19 will be there, and with other disaster even they are there. So that is existing for once that what we say that vaccine and others thing or public health system would improve, probably COVID impact would also be reduced. But other disasters which are climate induced are much more so that we need to develop with the frontline worker that how they are moving. Another point which I would like to mention about the child-centric DRR. that is investment in future. So they could also be made as a frontline worker. Frontline worker, like some academia is writing about that, they are also frontline worker. Frontline worker we have defined as a confronting this. But when we started this entire humanitarian issues with way back in 1884 or something, 1834, and after that we the example of what Major Jindal also mentioned about the bomb blast. And on this recently also we had a bomb blast in Lebanon. So an humanitarian worker and our old friend, very, very old friend as a humanitarian worker and officer also, Mr. Saroja, currently he's the head of the West Asia World Bank, got affected with the entire, many of the World Bank staff also got injured. So injury is another thing, but working for them is important. So we need to develop SOPs. And the children who are the most vulnerable, they could be taken. And last but not the least, invest in this capacity building. And I'm convinced, because I belong to the capacity building organization, NIDM and this sphere together organized with all the partners, this particular program. So we should not stop our journey here, Vikrant, and we should take up some of the way forward. And since UNICEF is also there and all the supportive partners, we can think of drawing an action plan and also formalizing and supporting these frontline workers in whatever the manner they want. So that is much more important as a outcome of this workshop, that what kind of whether we need institutional system or we don't need institutional system, that we have to discuss. But there is a need for definitely to have a kind of a very good mechanism so that the frontline workers can feel every time all people are saying unsung heroes, but how these unsung heroes could be brought in the mainstream of entire the process of humanitarian assistance. This is our challenge. They remain, today we are talking about that, but tomorrow we might forget. So some platform we should be giving. Today is a wonderful platform that we could listen and also learn from them, that how they are doing it, how these things will go in our mainstreaming training program, like what we are doing at NIDM. So for the officers, those officers who are interacting with the frontline workers, what kind of attitudinal change they might require when they are interacting with the frontline worker, what support they can render to them. These are the things to be worked out for the future, Vikrant. So maybe together Sphere and UNICEF, WHO, and all the partner organizations, we can think of, along with the National Institute of Disaster. Major General Manoj Kumar Bindal is not here, but he has conveyed that we will take up whatever the way forward is coming up. So I'm conveying my heartfelt thanks from him on his behalf, and to my personal behalf to you, Vikrant, and for organizing this wonderful event, and to all the partners and the speakers, and of course, naman to the all frontline workers, those who have given a very good learning and experience who have shared from this program. Thank you so much.
Thank you so much, Professor Santosh. I think it's always endearing listening to you. You come from the real experience of the real thing at all levels. I think both the front and behind, sir. And I think as you said the things, immediately few things for us as the way forward today is, I think it's good to share with everybody as our next planning, where we collaborated with NIDM and of course the supporting partners with UNICEF, WHO, World Food Program, and many others, and our partnership with the interagency groups here. So what we intend to look at in the next quarter as a forward action plan is that we do more localize this whole initiative of the academy, and we have more sessions led at the state level, supported through the academy again, and this partner again led at the state level partnership, SDMA, others government authorities, as well as the civil society groups at the state level, the interagency groups at the state level, and we run those sessions in vernacular languages. But while we do,
Vikrant, you can raise this question to this forum also, that can we just, why we are confining it to the day itself, humanitarian frontline worker. We can extend it as a week or say 10 days and one program, whatever the states which you are proposing to, had this kind of a continuum of this particular day itself.
Certainly, I think it's a very good idea. So maybe I think as is this one of the action point is that we take up this discussion as we need more time for having the discussion going on. For those we have not been able to hear today, maybe we extend this discussion over next few more days, and we hear more local voices, and with them we do this planning that what we need to do is together the next phase of academy.
I fully agree.
And yeah, and together we plan it out that how we have to roll it down the next stages. I think there are some interesting discussions in plan also, and it's not just the fighting about the COVID, but it also looking at now the specific issues and specific things. There are floods. The floods are there, but going beyond that, the resilience building and other aspects of it there is. So a collaboration is in place, and this collaboration will work. Will put us behind the frontline leaders to work together, lead to the new direction of the change. So I take this moment now to give my true appreciation to all of you, as well as for all the good work you're doing. And my thanks to our distinguished speakers today, General Bindal, Tom White, Dr. Tran, Professor Santosh, then Rahul, Prema Gopalan, we have Naseem and Godavari, and then we had a lot of other people we hear from different state leaders. Also, those who we didn't hear today, as we promised that we'll continue to come back again for the next discussions ahead. My thanks to our supporters, the team behind, and I hand it back to my colleague Michelle for the final logistics announcement. Anything else? Over to you, Michelle.
Yeah, thank you, Vikrant. Thank you for the incredible and effective moderation of the session. I would like to thank each and every panelist for such an enriching discussion. Before we end the session, here are some administrative directions. Your certificates will be ready in 24 hours. Visit our website www.sphereindiacovid19academy.org, and you can download your certificate by scrolling down and finding the name for today's session. It will be ready to download in 24 hours. However, if you are unable to do that, as some participants have faced technical difficulties, do not worry. You can email us at covid19academy@sphereindia.org.in, and we will get back to you as soon as possible. Have a great evening and see you all for our next session.
Thank you, Michelle.